Melanoma is a cancer of the pigment cells in the skin, the melanocytes. And basically, if those cells are hit with too much ultraviolet radiation, they can turn cancerous. If they turn cancerous, that's the cells that owe into melanoma. So you have to protect yourself from ultraviolet radiation, from the sun's rays, and from artificial rays like tanning beds to lower your risk of those cells turning into melanoma. Early detection is absolutely critical when it comes to lowering mortality rates, because melanoma is probably the most clear-cut case of a cancer where if you catch it early and treat it early, it's not that big a deal, but once it is spread, basically nothing works. Melanoma is a very significant cancer with significant public health and cost impact in the United States. At current rates, 1 in 52 Americans will get an invasive melanoma during their lifetime. 1 in 25 Americans will get some kind of a melanoma in their lifetime. So 4% of Americans will get melanoma sometime in their lifetime. And the rate is increasing dramatically. It's one of the few cancers in the US where the cancer rate is still going up despite everything we're doing. And more importantly, the number of people dying from melanoma is also still going up. And that's where early detection is critical. This year, over 9,700 Americans will die from melanoma. We'd like that number to go to 0. We want everything possible to happen that encourages early detection. Patients come in for many reasons for having moles that they're concerned about, or having a family history of melanoma, or having a family history of a lot of moles. A full body exam from head to toe is really important to help to make sure that we're not missing anything. And then the next challenge we face is if there's one lesion or more than one lesion, do those lesions need to be biopsied? When we see patients with pigmented lesions, our main goal is not to miss a melanoma. What we want is to try to optimize how we do this. Until recently, we didn't have the technology that was available in many other specialties to do this. But now, in fact, we have a device, MelaFind, that gives us additional information to help us with the biopsy decision and make our biopsy choices much more efficient. So if there is a lesion on a patient that we want to use MelaFind on, I would identify the lesions, use the video head on the machine that play right on the skin on that lesion. At that point, the data is taken into the machine. It does its calculations. You see all the calculations occurring on the screen, and we get a result, and it gives us very good data. What makes MelaFind unique among diagnostic devices to some extent is the fact that it really gives us information, and we can take that real-time information and integrate it into the treatment and management decisions that we're making. So the patient sees that result, and it makes them feel comfortable in the outcome.